Today's episode brought to you by Owens Recovery Science, a single source for PTs who want to add personalized blood flow restriction rehabilitation training to their clinical practice. Get certified at owensrecoveryscience.com. The all-in-one outpatient PT EMR built on automation. That's Empower EMR. They empower owners, physical therapists, billers, and your front desk to profitably provide the best possible patient care experience. Find them online at empoweremr.com. That is empoweremr.com. All right, let it rip.
All right. Here, should I get in front, I guess, for a second?
Yeah. It's a live stream, Mike.
Live stream, I know. I don't do this very often, Jimmy. I got you. Hi. How are you? Okay. So, welcome, everybody. We are live streaming this one today. This is our alternative business model panel slash cash-based panel here today at Nazareth University for business and administration for physical therapists. I'd first like to welcome Jimmy and thank him for having us on here. Jimmy, can you give us just a little bit of your background? I know the folks that you're live streaming to probably know you, but let's give a little background here to the students.
Yeah, so I consider myself non-traditional. I have a degree from St. Bonaventure University, go Bonnies, in journalism and mass communication. So I actually worked in radio and communications, was on air and ran radio stations for about 15 years before I decided to do a little bit of a career pivot. Did that and went to PT school in 2013. And while I was there, you still needed to explain to people what a podcast was, but I sort of felt lost and confused as a PT student. But I decided to pick up a microphone and start a podcast because that was, normal to me, or felt normal to me, to use it as sort of a cheat code and learn about the profession. It was supposed to be like a 6-episode thing. It was supposed to be a goof. And it's been about 9 years that I've been hosting the podcast. I did treat clinically for 3 years in orthopedics and peds, sort of split my time there. But the entire time I was doing that, and even while I was still a PT student, I was working for getting hired by APTA sections or academies. I was getting hired by companies to sort of help them with media and communications. Because the idea was, who better to help a PT organization communicate the value or the benefits of PT than somebody who was a PT student or when I was a graduate. So I worked for large and small PT organizations in my career. I haven't worked clinically since 3 years after graduating. Right now, I work sort of a myriad. I work for APTA Orthopedics, which is one of the largest components of the APTA. I get to help them with media and communications and member retention. I work for a cool health tech company. I almost want to call them a startup, but they've been around for 5 years. And Mike, I don't even know if I told you this. They actually make health technology. So these are the Insight Pro Plus goggles that we make. Essentially, if you work in vestibular care, they're like night vision goggles, so you can do great vestibular assessments. So I've got to put two random careers together, and my parents are still very confused what it is I do, but I have fun doing it. So that's my non-traditional PT career.
Excellent. Thanks, Jimmy. Brenda, how about you?
So I graduated from PT school from Ithaca College. That's actually where I met Dr. Huson. We go way back. And I spent time kind of traveling through different types of orthopedic settings. I was attached to a hospital for a while in a spine clinic. That was my first job. And I started managing that clinic and it was part of a regional kind of PT conglomerate. So I was managing that clinic and then moved back home to near New York City to get married. And I was in an orthopedic clinic there that was attached to a busy gym in Manhattan. And both of those experiences gave me a lot of experience, but also the want and the desire to do more with my clients. And in both of those experiences, I started to I think people kind of picked up on that on me. And so I started to take some private clients on the side, which was approved by people that needed to approve it. But I started to do some after hour care the way that I wanted to do it. So that was kind of where my passion for owning my own business and doing things my own way began. And then we moved up to just a standalone private sports therapy clinic in Connecticut. And that is when I started having my own babies and realizing the gap in care. So my business kind of comes out of my story. So I realized the gap in care that was given to new moms, especially active new moms who weren't having difficulties but needed to get back into life and running and all the things. And so I started She Thrives PT in 2017 here in Charlotte, North Carolina. We moved here to raise our family. And I came down here from New York City area, and I had space and I didn't know what to do with space. And so we converted it to a clinic. So I treat out of my home, and I am a private pay cash PT. And I work with women, anything to do with core pelvic health, but also I have that whole entire orthopedic background. So I kind of say I treat anything, but we focus on the root of things. And I came out of the gates like with my niche of pregnancy and postpartum. And I'm part of a nonprofit here that I helped to found. And so those are the types of people I see.
Awesome. Thanks, Brenda. Bryan?
Hey guys, Bryan Guzski. I'm a physical therapist and strength and conditioning specialist and nutrition coach, so I do a little bit of everything. I graduated from Nazareth College in 2014, and then met my girlfriend, now wife, here in Rochester, so I've been in Rochester since 2015. I worked with University of Rochester Orthopedics for about 7 years. During that time, I actually went back to school. Went back to business school and got really interested in entrepreneurship and business. And while I was at the University of Rochester, I was really involved with education. So I taught in the orthopedic residency program. I worked a lot with spine, kind of running related injuries. And I really loved the patient care and coaching side of things. So after I finished up school, I decided to kind of start my own thing. So it was a slow move, slow transition. I went down to per diem. I did some inpatient rehab work to kind of fill the gap as I transitioned into my practice, which is motive physical therapy. So right now I rent space in East Rochester, Penfield area. It's like a multifunctional health space with massage therapists, personal trainers, and a few other professionals in there. So we all kind of work collaboratively out of the space. And that was about 2.5 years ago. So this will be kind of my third full year in operation. So fully cash-based, out of network, private. So it's been a fun journey so far, and looking forward to telling you guys more about it.
Entrepreneur, inventor, hopefully.
Oh, jeez.
We're working on some running stuff, so actually pretty cool things that we got going on too.
Yes.
Derek.
Hi guys, my name's Derek Hagen. Sorry, I'm a couple minutes late. I had to get the kids to school, not the bus, but to school. I am a physical therapist as well. I hate to say how long I've been doing it now, but it's been 15-ish years that I've been practicing. Pretty much all outpatient ortho type stuff. I've dabbled in home care. And what I did when I graduated from Wheeling University in early 2000s. So we graduated from there, worked in outpatient ortho, seen a lot of patients, a lot of volume, which I think we might touch on later on, but I think was very beneficial to seeing a lot of different types of people and interacting with a lot of different types of people. And I think that helped me a ton grow socially, emotionally, all of that, to be able to talk to people a little bit better. I did that for a couple of years, then moved up to New York because, my girlfriend / wife is from up here. And so of course, here we are. So did that, lived up here, ended up getting to an outpatient ortho place, was director of physical therapy there for a little while. Was still dabbling in home care, was doing stuff here as an adjunct. So kind of, juggling 3 jobs at the same time. But then I had a friend who was back in Ohio, physical therapist, that Also started a cash-based physical therapy clinic down there. Was keeping me up to date with what's going on with that, how successful it was. He said, "Oh, you got to do it. You got to do it." He still wants me to this day to move down there to be with him, but and grow his business. But so I just one night just said, whatever, screw it, I'm just going to start it. So I started a business, and the next day went down and got all my legal stuff situated, got a town hall, and basically just started it up right then and there, and just tried to figure it out from there. So it was very, very from the ground start, but I've grown it to now where I'm in a gym not solely, but I can venture out. My liability insurance allows me to go wherever I need to go. It follows me everywhere I go. So I can treat in people's homes, I can treat in parks, I can treat in parking lots, I can go wherever I want, but I have space in a gym in Webster where there's a lot of people who want to stay active and be active. So it's a nice environment there. My business is called Hagen Movement Institute, and I have that name for a reason. Because it's not specific like, oh, Hagen physical therapy, it's movement. Oh, what's that mean? It gets the conversation going and has a reason behind it, whatever. So that's my business. Been doing it for 5 years, I guess now. I started in 2019. COVID made my full-time job at the time go away, which was probably a blessing in disguise. So I made me focus on just this business, and now it's my number one thing. And that's what I do, treating people one-on-one, cash-based. Again, out of network, same type of deal. So it's been fun. We'll touch into more details, I'm sure.
Awesome. Thanks, Derek. All right, let's open this up to you all. You've got some great folks here with some good experiences. What do you want to ask? Who's first? All right.
To be great, just core question is why cash-based? So I'd love to hear from each of you guys. One of the biggest pros, one of the biggest cons of going your non-traditional route, and no repeats.
No repeats. Yeah. There we go. Who wants to take that first?
Piggyback off of what they said. Can't say that. No corporate lingo.
Yeah, I'll go first. So for me, it was kind of out of necessity, I guess. So just there's some administrative hurdles and a lot more paperwork if you're going to contract with insurance companies. At least that's my knowledge. So when I started out, I actually started out as a mobile practice, so going to offices, gyms, and homes to work with patients and clients there. And I just didn't have the time or really the knowledge or the drive to learn about negotiating with insurance companies. So it just kind of eliminated the friction and how I saw it. Cash is just a means of expressing value, and that you kind of value the service that you're paying for. So so when I looked at it that way, I wanted to find patients and clients that saw value and how I would be able to help them and solve their problem, and not kind of relying on insurance allowed me to do that a little bit easier with less friction. So yeah, that's kind of in a nutshell why I went cash.
I like the idea of freedom, freedom for my schedule, freedom for how I want to treat people, freedom for how long I want to treat people, how often I want to treat people. Insurances obviously dictate a lot of that kind of thing. When they run out of visits, that doesn't exist in cash-based. It's whatever I want or I think is best for the patient based on a collaboration, a synergy with the patient and myself. That's what we like to come up with is a plan of what we're gonna. And if that means seeing them once, then it's seeing them once. If it's seeing them 10 times, it's 10 times. It's whatever it's based on that individual case. So the freedom was nice, making my own schedule. I don't have to, send in a paperwork 6 weeks in advance for a PTO request or anything. I just don't go do work. That's all. So it's nice freedom that way. A con for me, those are the pros. And there's no ceiling for me also for like income or drive or whatever. There's no ceiling there where you only are going to make this much. It's whatever you make it to be or you want it to be. A con for me is the salesmanship part of it in my mind, in my social aspect. I don't like being a salesperson. I don't like selling myself all the time, but inherently you have to as a business owner, I believe, in this kind of industry. So I think that's one of the cons, I guess, but some people thrive on that, and that might even be a pro for some people. But for me, that's just what it was, because I don't want to sell myself. I just want the product and the result to be the reason why people are coming to me. I don't have to explain every single little piece, which I end up having to because it's just part of the business. But learning how to do that takes, to me, time and a little bit of effort for me. So.
All right, Brenda, how about you?
So it as well, kind of to echo some things. One, for ease, because when I came out of the gates with this business, I wanted it to grow very slowly and easily, and I knew nothing about starting a business. I called the APTA, I called our local business bureau. I was like, what do I do? And what I couldn't take on was trying to figure out the whole insurance contracts and games and have an administrator with me, because it was just me. So I was focusing myself on growing my business. So part of it was ease, but also I really wanted to do things my way and not insurance's way. I wanted time with my clients. I had this vision, and this is what I've done, of kind of being more of a partner in care, where we can, kind of like Derek said, I mean, I see people once and then I see them again in 6 months if they're doing well. We design a care plan based on whatever it is that they need. And I've had people under my care since 2017 who just come in, for, I call them tune-ups, but, check-ins, and to learn something more about their body. And also that preventative piece is really hard with insurance companies in pelvic health, especially because I do pelvic health. It's very difficult to get pelvic health covered by insurance. And so, because it's seen as more of preventative care, unless you can't walk, that's what they would say, right? Can they negotiate? Can they take care of the baby, negotiate the stairs in their house? Okay. It's not necessary, but I believe very strongly it's necessary. So it's my population as well. It didn't make sense to go through insurance. So those were some of the pros, and just the flexibility of where to treat, and being able to go and do workshops in the community, and being able, I stop into people's houses sometimes if they need me to. Most people do come here, but I wanted it to be this true, I am a partner in their care. And when something pops up, if we're treating something and then their neck hurts, I can just treat their neck. I don't have to get a new script for it. And I am in North Carolina. I know that the governing rules are different than New York, but in North Carolina, we don't have a restriction on our visits under cash-based PT. So I wanted to eliminate all that. And then cons for me, is really because I do feel like, in a way, some people avoid coming here, of course, because they want to go through their insurance. And I feel like I could help them, but naturally, and I completely understand that. And I have insurance PTs that I refer to all the time. So kind of feeling like I can't help people who I know need help is a little bit of challenging for me, but that's also why I do free workshops around the community, and I work with a nonprofit. So I feel like I'm still giving my information and my knowledge to people who can't financially afford to come see me. And there is an element of salesmanship as well. With my caseload, because people are looking for something different, and they've already tried to get physical therapy and it's not covered. I don't have to have that conversation as often. It's not as difficult, which I love. But there is an element of explaining who you are and what you do and why you're different. And so that is something that can be challenging sometimes.
It's all cash. It's all cash. You either paid for it before from your paycheck into an insurance company, or you hand it over right there. It's all money, right? Mm-hmm. Deciding what relationship you want to build, what that person's actually looking for. That's the difference, right? That's like, I'm a cash-based PT. We're all cash-based PTs. We like to buy cornflakes and pay rent and pay for our student loans. Those are coming, by the way. But you decide who you want to work with. That's the first step in an advertising campaign, and it should be the first step, in my opinion, in opening a business or a practice, is what relationship? What am I selling? There's a great business writer named Seth Godin. He says people don't buy products or services. They buy relationships, stories, and magic. That's what they want to buy. If someone says, I don't like selling, not to knock anybody, right? I don't like selling. No one does. Ask them what they want to achieve. Isn't that what we teach in evaluation, right? What do you want to get? I told you I work in communications, right? Some people would say I sell goggles. I don't. I talk to vestibular therapists and ask them what their limitations are. I cheat. I make everything about them. That sounds a lot like PT, doesn't it? Right? When you make the conversation about them, you don't have to sell anything. You're deciding. Actually, you're leading them to the end of the diving board. Is this the right place for you or not? Because people will ask 3 questions. You're asking these questions right now as you sit in class. You're asking these questions while you're swiping on Instagram, walking down the street, watching TV, or scrolling. What does this do? How might it make my life better? And then if I like the answers to those 2, if they fit, what do I need to do to get it? I either run it through my insurance or I hand you money. Let's be honest, I swipe a card. But you're asking, is this worth that? This is a seesaw. Is there enough value on one side for the price that you're asking me to pay? That's it. It's the value and price seesaw. So I think this is a smart question and good question. And the add-on, no repeats, is a terribly good add-on. It's very good. A lot of people pay attention to the right side of that seesaw. What's it cost? I would tell you, if you want to win and do well and do whatever you want, like a lot of these people on the screen, focus on the left side. There's a business that focuses only on the left side, right? And that's Amazon. I'm going to venture that 100% of the people in that room have Amazon, right? Have no idea what they pay for it every year because all they do is focus on the left side of that. They overload on value, so you never question the price. What if you could do in your practice? I think you can.
All right. Next question.
All of you kind of touched upon in more of like an outpatient setting, right? You get like referrals, or a lot of patients get like a list of these are the PT facilities like in the area, like kind of go through it and maybe what does your insurance like cover, but how are you all getting people like in your door?
Derek, you want to take that one first?
Okay. How are we getting people in the door? Sometimes I feel, depending upon your situation and cash-based, you got to go find people. To me, the most interactions you can make, that's what you need to do. You got to get the volume out there, whether that means go out and sell yourself to events, workshops, tables, whatever it may be, to get in front of people, get in front of the community. I like my situation where I am because there's hundreds, thousands of people walking through the gym every single day, and they walk right when they walk in, they walk right by my side where my little office space is. I have access to 25,000 square foot. I walk around, I be visible, and then people see me. So then reputation, then word of mouth, and then that all kind of spins around. So I've a couple of new patients this week that is solely on, I heard about you, you got a good reputation. They literally tell me that just from talks amongst the gym people. It's all about just patient interaction, people interaction. I haven't recently gone out and sought after physicians or surgeons or anything like that. I think there's value in that to some degree. I think you can. There's a way to still do that. But even those are tough sells because they still want to do the insurance space. They already paid for insurance, so we should go with insurance. It's but that's not true. It's the quality is what the quality is. So it's all about what they value, like Jimmy said. So I think to get people in the door, it's all about volume of patient and people interaction. Just getting out there and talking to people, as many people as you can, to increase your odds. I think that's the biggest thing. That's why I liked getting out of school, kind of just being thrown into a high volume environment, seeing a lot of patients all the time for 2 years straight, just nonstop basically. And that was great. So I learned a lot of different diagnoses, which is fun to me. I like doing everything head to toe, and different types of personalities, cultures, all that stuff, so that any conversation I get thrown into, I'm fine, I'm good to go. Just keep talking. So.
Bryan, you want to take it since we got the camera on you?
Yeah. So I think a big piece of it, or what's worked well for me, is going to the places where kind of the patient and clients that I want to see are. So for me, that looked like going to local races and kind of setting up a table and having conversations, or just being present there and having conversations. That looked like going to gyms. That looked like doing different talks, different businesses locally on like health, wellness, and almost like workshops. So kind of going to where your target market, if you will, are, and doing the things that they want to do and perhaps are limited in the things that they want to do. So I think word of mouth, especially starting out, can be really powerful when maybe you don't have access to being in front of a lot of people, like Derek was saying. So kind of asking, a person that maybe you have a successful, series of visits or treatments with, well, do you know anyone else that might be looking for help, or where can I find more patients and clients like yourself? And kind of having a conversation like that, they might be able to give you good insight as to how to find more people. And again, kind of word of mouth is one of the most powerful, at least I've found, kind of referral sources, if you will. So it's always good to have relationships with other professionals locally. That doesn't need to be, MDs in a big medical system. That can be massage therapists, chiropractors, acupuncturists, people that are trying to help the same type of people that you are. And if you create kind of a reputation of yourself as being, really, kind of not necessarily a specialist, but doing a good job and being good with patients and people, you'd be surprised how powerful that can be, that reputation. So that's another way, is to kind of build a network of other professionals, and that can include doctors that get kind of the paper referrals, or that can be other clinicians and other professionals.
Awesome.
Mm-hmm.
How about you?
I have never gone out and spoken to a doctor about what I do. Doctors know about me and they refer to me, but it's all through my clients. I think if you do a good job with what you're doing and you get that first client, and then it just snowballs, and it's word of mouth, and it's having conversations out in the community and building on the curiosity of people. People ask me all the time, what do I do? And like, what do you mean what's a pelvic floor? I don't even know what that is, So these conversations, and I was way back, I got the advice when I first started my clinic or my business, to give more, like just give information, not in a formal setting like a workshop, but just show up and answer questions and just give in the beginning, and show yourself as the expert and develop that trust before people even come to see you. And so that is what I did. And I think that is what has created this word of mouth network that I don't even need to feed that often. Because people know me, and when they come to me, they talk about me, especially because I work with moms, and the mom community is so strong with information, with things like that. And then also recently, I would say something that has really benefited me. I'm very technology resistant. I know we use it all the time, but I don't feel like I have a lot of time for it. But I hired somebody to help me with my website and help me with my SEO, and I'm writing more blogs. So a lot of people are coming to me right now through Google, and I love it because they come in and they say, hey, I always say, how did you find me? What do you know about my practice? And the people who say, oh, I just Googled you and you're the only pelvic PT in Charlotte. And I'm like, oh, no, I'm not. But yay, my website's doing an awesome job communicating what I do. And so that has ramped up. I was doing just kind of word of mouth and just letting people find me and doing workshops in the community. And now Google is helping people to find me because I have had help with that. I couldn't do it all. And so I needed to, upgrade. I needed to outsource a little bit.
Well, Brenda, is that 100% accurate? I don't want to overcorrect, right? But I want to highlight something that you had said.
Okay.
You said they Googled me, but if they didn't know about you, how'd they Google you, right? So you mean they searched for a solution,
yes,
and you were there already? My dad
yes,
said
search for the question. Mm-hmm.
Right. So they had a pain point. They were hurting for something, and they did what we do to solve it, right? which is what the gentleman we're talking about. I went to someone, I didn't know who to solve this problem, so I asked a doctor or I asked a friend. And then that person, you had already put a thought in their head, which then put words in their mouth that came out, and that's word of mouth. But what you did is you were where they already were, or where they were going to be when they had that pain point that you decided you wanted to solve, and then you went there before they were there. I worked for a hospital research lab for a little while. That was something I wanted to try. I do not belong in research, but I got to work with a research organization to get funding for research and then to get participants. Research teams need both of those things. And their previous way of getting both of those things, well, I should say more of the participants, was putting up flyers on the walls of the hospital. And I said, how effective is that to getting participants in your research study? And they say, not very effective. I said, because the people that you need to talk to are not in the hospital. They're out of the hospital. So what Brenda did, I want to highlight that, is she was digitally, and you even said, I think, I don't really, the online thing, not my thing, but a little bit of work, and you were able to actually leverage that, and you were where they were.
Mm-hmm.
Yeah. So
it's to give information. I like to write blogs, and so I just needed to connect my blogs to the SEO. Like, what questions how do people find those things, right? What questions are they asking? But that goes back to the advice that I was given that I love. It's just like, give information. People don't know what they're looking for, and the more you can just talk and give, then they will realize that there might be a solution out there.
It's hard at first, I imagine, because guys, you talked about this too, in terms of, having to sell, right? You don't have to sell if you're communicating and you're giving value. Probably hard to do when you're at zero, right? As a lot of the students are probably like, hey man, if I graduate, I'm at zero tomorrow. What do I do? And I know this from working with practice owners or companies. There's an impulse to just flail and do everything and try this and try that. How did you resist that in the beginning of your practice? To do everything, to just do, you can't do everything, right? But how did you resist that?
I don't know. I don't know if I resisted it well, personally. I feel like I tried to do everything, and then realizing that doesn't work, and kind of coming back to center, and like just getting back into, let me just do a really good job with the person in front of me. And because that's what I'm good at. That's why I'm doing what I'm doing. And that is what makes me the expert, is just that person in front of me, not all this.
I have news. That's sales. That's sales. Asking someone what their problem is, and then hang on a second. This is where like the magic comes in. Being quiet long enough for them to tell you. That's sales. It's all under communications. Most of the time when I give presentations or people want to hire me, the very first slide, I think I have 3 slides, is 2 tin cans and a string. That's what you're doing. You're connecting to someone else and deciding this person is not a good fit, right? I might get them in the clinic and get an evaluation done. 3 days from now, they're not going to be a good patient. Good. Don't build that relationship. Not like that.
So, Jimmy, let's give you this question too. So how have you built your following and the folks that you work with?
Yeah, I'll give, right? My favorite day in 3rd grade was show and tell. More for show. Tell's fun, right? Show. There's no such thing as tell business. It's show business. And I have news for you. This is a hill I will die on. As a physical therapist, an accountant, a house painter, a plumber, you're in show business, especially today. So how can you show someone that you are the best possible solution for that particular problem? There are 100 different ways, and they're all mediums: pictures, videos, sounds, words. That's media. So for me, this was not strategic. I would love to say this was strategic, starting a podcast. I was going to go be a physical therapist, but I just started doing something out of my own insecurity and finding people who were the best solution. So instead of buying books in PT school and reading them, I reached out to authors. They sent me a free copy of the book, jackpot. And number 2, I knew I learned more by talking than I did by reading anyway. So I had unfettered access to experts for 45 minutes. Wouldn't that be great if patients had that access to Brenda, which it sounds like they do, except she wrote a blog 3 months ago, and now they have access to that whenever they're looking for it. So it's show versus tell. And how can you show value before you ever walk in the room? And the quickest way to do that is, and I'm biased because I work in media, is creating digital copies of yourself, like this live stream. So my answer to that is understand what business you're actually in. And getting someone's attention is showing them that you are a fantastic solution to their problem.
All right. What's next? Next topic.
Keep going. So I just want to know from like each of you, either tell like a patient story or maybe it was on the business side, but what was the first time in your business where you really were like, I'm so glad that I did this. Like it just, everything came together, whether it be a patient or something. Like, how did you know that like this was definitely what you wanted to do? Or like when you finally got that positive feedback?
Brenda, you want to start with that one?
Gosh, yeah, that is such a good question. I can honestly say it was my first patient, but that's not the story I'm going to tell. But she still is under my care today. And I felt so happy when she found me and she came in the door. She was my first patient ever. She scared the crap out of me because she had something going on, a surgery that I had never seen before. And it was also, actually, I'm going to tell this story because that was also my moment of like, what am I doing? Like, why am I'm here by myself with this person and I've never seen this going on before. Like, okay, we've got this, but it validated everything I've wanted to do because I helped her, not even knowing what she had, abdominal surgery. So, and it was done very poorly. So, but I helped her, and that was what I wanted to do. And she's still under my care today. However many years later this is, 8 years later almost. And she just comes about once a year now, again, just because we've developed this really good relationship and she trusts me with her body. And so she comes in and she says, I feel great, but can you just like look through everything and look at my balance and see what's going on when I'm lifting weights and all this kind of stuff. So anyway, so she was my first, oh crap moment. And also my first, like, this is why I'm doing this moment, because I got to the other side of it and not won her over, but realized that I'm good at this and I want to do this forever. And then the story that I was going to tell before I started that one was another person who really validated what I want to do is someone who had been through, she's actually an older client. She did not just have a baby, but she had been through the ringer of healthcare and she had been struggling with debilitating back pain for years. And she's very active and she had teenage kids at home. She's always running around. And she found me actually she was my first person to find me on Google. And she just came in and she was like, I don't know if you can help me, but I've tried everything. And so she was, again, somebody in my practice that I was like, yes, this is why I do it. This is why I'm here. You know, she, like, the insurance world failed her. She'd been in and out of PT, doctors, and everything. And so she is a great one as well.
Awesome. Bryan?
Yeah, I think so I'll preface this by saying there probably isn't a week that goes by that I don't, question whether or not this is the right path. Like, would it be easier on the other side or kind of working for someone else? I think that's just kind of the, comes with, being an entrepreneur and owning your own business. I think that's pretty normal, based on the conversations that I've had. But that being said, I do think this definitely was the right choice for me, and I do love it and enjoy it. And I think honestly, it was the first time that I was like paid, like somebody wrote me a check to like work with them. And that was, about 2.5 years ago now. So yeah, I mean, I did what I thought to be a thorough assessment, understood their problem, talked about, how I was going to be able to help them, what their plan of care would look like, and we bought in, and that was pretty cool. So yeah, I remember that vividly, and it is a little bit of, if you guys do kind of start your own practices and go off and do your own thing, it is a little bit of a drug, right? It's like kind of a hit of, wow, like this person trusts me, there's this trust relationship. And then after you kind of establish that trust, there's loyalty and advocacy that follows. So once you start to see that happen, where this person trusted you, they paid you, did a good job, took care of them, they got better, they're now loyal to you. They're gonna, if they have another problem in the future, they're probably going to come back to you. But then also they become an advocate and they start telling other people about you, and it's kind of this ripple effect that can be really, really powerful. So yeah, just definitely that first time was pretty cool.
I like that, the dynamic there, because I was thinking of both ends of it, of feel good story versus money, right? And my first thing went to the money part of it, because I got 3 kids, I got a family, I just started this business, I have to provide for my family. So yeah, to validate that, when somebody easily, without hesitation, wrote me a check with 4 digits on it, a crooked number at the beginning, that validates it a little bit, right? So that is a nice chunk to say that, hey, this is correct, this is right, this is going to be feasible for the future. The feel good stuff, I think, happens kind of throughout, no matter what, hopefully, I should say, throughout your career, wherever you are. Because I remember lots of those kinds of situations when I was doing insurance-based, because you care. Hopefully we get into this industry mostly to help people. So I remember all these situations where you're getting these people up and running again and haven't walked stairs in 20 years, and now you got them box jumping and stuff or whatever. There was that situation in insurance, but when it's attached to your business and your baby, basically, to me, it just holds a little more weight. So when people haven't climbed stairs correctly in a decade or more, and then I have them lifting weights and doing, 100-pound lunges or 300-pound squats or 400-pound deadlifts, it's like they're super happy, they're in tears to do that. And that's, the feel good combined with the actual feasibility financially is, to me, I think, dual situations. So
it's a good marriage, isn't it? When you can find that sweet spot.
100%.
Right?
Yeah.
Jimmy, how about you?
Yeah. Are these third years that are in the class?
Yes, they are.
Yeah. So mine came when I was a third year. So I went to Marymount University as a PT student, and we, in our third year, we get to go on a service trip. This was to Costa Rica. The problem was, as I was getting closer and closer to graduation, all my classmates were getting more and more confident about where they were going to practice, what setting, who were they going to work with. Like, they were getting very, very certain. And the more certain they got, the more uncertain I got. Like, the closer we got to graduation, I was starting to panic. And the reason was, I liked all my rotations. I sort of liked everything I was looking at and consuming and touching in PT, but I didn't love any one thing. So I actually sat down with my advisor and I was like, I think I should bail out. It's probably like 6 months before graduation. And she, asked why. She was smart. She put the questions back on me. Why? Tell me, walk me through that. And I explained, I don't feel like I fit. So I might as well start looking. I started to panic, start looking for that thing that I'm going to do, because this isn't it. And she said 2 things. Number one, you're going to owe the money anyway. Like, you're 98% of the way through. You might as well finish, get the degree, which is practical. So she grounded me with that statement. And the second one was, she leaned into my fear. You're probably right. You're probably not going to find anything that's perfect. You're probably going to have to build it yourself. And that sort of woke me up. And I went back to class and started studying, because I had to pass the test, because I was going to owe the money anyway. So fast forward to the service learning trip, we went and worked in an orphanage for 2 weeks in Costa Rica. And I actually have pictures of that patient. So you asked me for like a specific patient. So I'll paint you a picture. In the orphanage that we got to work with patients for 2 weeks, most of them had CP, really severe CP, but there was one kid who had muscular dystrophy. So I got paired with him. So 2 weeks, this kid, happiest kid on the planet. All you got to do is be around him. Just smile from ear to ear. Living in an orphanage his whole life. He was essentially stuck in a chair all day. He had a little bit of wrist function, a little bit of cervical rotation. That's it. That's all he had. And he was the happiest person I probably had ever met, and still to this day had ever met. And for 2 weeks, he just showed me what being happy looked like, and I could help him. We brought him down his first water slide, much to the dismay of the nuns that were living in the orphanage. They did not like the fact that we just brought him on a water slide. Brought him to his first movie. He'd lived no more than a mile from a movie theater, had never been to one. So we got to do all those firsts. But the problem was we left him no better than we found him, because you don't fix muscular dystrophy. So I left and was heartbroken, but then decided, could we change this person's minute-to-minute existence? I can't do anything with my hands. I can't change muscular dystrophy. So we decided as a class to raise money and get him a power wheelchair because he had wrist function. But right now he's in a tilt and space chair where he was put. He sat all day, happy, but sat. So we decided to raise money for a wheelchair. So we raised $33,000 in 66 days, which is not bad for a bunch of PT students who are trying to graduate. So I actually had we've got the photo. Like that's when I got to bring the power wheelchair that we raised back to Costa Rica and teach him how to use it. And for the first 10 minutes, he looked like he had a couple beers, slamming into walls. I said, please don't destroy this $30,000 wheelchair we just fundraised for you. And about 15 minutes later, he piloted himself down a path through a door frame and sat himself at the head of the table for lunch. And that's when I realized that you can use different skills in different ways to solve problems. And my professor, again, who had convinced me not to quit, said hundreds of PT students had been to that orphanage over the last 10 years from several schools. He'd been there most of his life. Lots of smart people had seen him. You saw him differently. And that's not to pat myself in the back. What that's to say is, what do you see in someone in front of you that you could help them in a way that they might have never been helped before? So he taught me the biggest lesson. I thought I was there to teach them stuff. Here I am, the PT student coming to Costa. I'm going to teach you all everything. He taught me that I can take my skills in different places. Is it non-traditional? Yes. Is that scary? Absolutely. Every single day. And I've been doing it for a while. But it's out there. And if you work, which I'm very sorry, you're still going to have to work at this. Still work involved. You can find it. You can make a living. And even better, you can be fulfilled.
Awesome. So again, we've kind of heard this marriage between finding what we want to do, right, and making it feasible. And sometimes you have to kind of blaze your own path, right? And we're kind of hearing that. And Jimmy in the past has said his favorite diagram is a Venn diagram, right? So that's what you're looking for. You want to find that sweet spot. It may not happen right away. Every person here that has spoken has talked about how they worked in different places before they got to where they are now and kind of found their sweet spot, right? But you have to build those skills and figure out exactly what you want. You don't always know what you want when you come out. Did any of you see yourselves in the position you are in now when you got out of PT school? No.
I honestly, I feel like I was so naive back then. Because it was, 4 decades ago. It was at its infancy, I think, with cash-based. I didn't even know it existed until probably 5 to 8 years into my career. I didn't know it existed. I was just so blinded by everything. I probably wasn't seeking out the information either. But I didn't. During PT school, they asked, what's your 5-10-year plan? It wasn't really to own my own business because I knew it was a lot, I thought it was a lot to manage, and I didn't think it was worth my time to do all that. I didn't think it was feasible, all that, but definitely didn't see this for sure.
I can tell you the same for me. If you told me I was going to be teaching, first of all, my professors would have laughed at you. Brenda would have laughed at you. Brenda remembers me. I would have never thought I would be here. My whole thing was I was going to open a private practice, which I did. And I was going to run that for the rest of my life, which I didn't. I did it for 15 years. Yeah. That was plenty. That was plenty for me. So where are we going next? Well, let me do one more question and maybe take a little break.
So we talked about your hell yes moment. What was like the biggest challenge, a setback, a hurdle you had to get over creating your own business?
Jimmy, you want to start this one?
Sure. I get them every day. My biggest setback, I mean, I don't know. When I ask people questions like biggest or most, I get frozen because now I got to pick just one. But there's setbacks every single day, right? I mean, I'm a physical therapy radio DJ. That doesn't make any sense, right? A podcast, do other stuff behind the scenes, but none of this was planned. So biggest setback is every single day, right? I imagine, because I talk to other practice owners as part of what I do, is that, man, is this model going to exist in 3 to 5 years? I'll give you an example. Brenda said she writes blogs. That increases her website's SEO. So she's found in her town. Right, Brenda?
Right.
There's a new technology out there called artificial intelligence. I have started to shift when I have a problem. Instead of Googling something, I ask the AI. It gives me sometimes more accurate information. What's going to happen when AI kills search? How will you be found? Congratulations, Brenda. Thanks for typing. All that SEO does not matter. Doesn't matter. Uh-oh. That's going to be a setback that Brenda can start thinking about now and figure out how she's going to solve it. It's still 2 tin cans connected by a string. That's it. Where are the people? Where are they going? Well, you can't really get into AI. I had somebody from a large physical therapy organization say, how do we get into the AI so when someone types a question, we're the answer? You don't. You're either the answer or you're not. I don't know the answer to how, when AI kills search, how will people be found? It's something that makes me curious. 5 years ago, it would have made me scared. Now it says, you know what? I'm in the same storm as everybody else. We'll figure it out because we just have to find where the people are so we can ask them what problems they have and then show, not tell, how we're the best solution for that. So to me, my biggest setbacks are every single day because I'm making this up as we go along. But I hear from a lot of people in business, we're all all this is made up, guys. Society's made up. It's all made up. I know it's scary, but once you hug that and lean into it, I think that's when you actually get freedom. Is that a good way of not answering the question?
I like it. It's a good answer.
I think just as I think most of us here are kind of like solopreneurs, like doing everything ourselves. I think there's just a lot to juggle and you have to wear a lot of different hats. So, I mean, obviously, like you're focusing on the patient care and you're doing a good job there because that's arguably what matters most. But then marketing, networking, doing your books at the end of the month, like making sure things are okay with your bank account, making sure like your consent forms are like up to par in terms of how they're worded. So it's just a lot. But I think if you're kind of a really structured, live by your calendar, you don't need to live by your calendar, but live by your calendar type of person, you kind of just get used to it and you adapt. So I'd say that's a challenge. And then the other is just during kind of slow times. It's like, how do we stay positive? How do we, what do I need to do to kind of remedy this? Talk about in business. I'm sure you guys talk about like leads. Like leads are people that potentially will be seeking out your service. Well, how do I get more leads? Like how do I get more people asking for help? So that's another point or another challenge, I guess. It's just when kind of things are a little bit slower than you would like. But what do I need to do to kind of like to change that?
I had setback wise, as a sole proprietor, as a independent cash base, I can work with organizations. Worked with a local soccer organization doing a performance training program. One of my biggest setbacks was recruiting PT students at Nazareth to help me with those programs. Right? That's a joke. The question asker is one of those people. So anyway, one thing that always pops in my head when it comes to setbacks is the story very early on when I was still juggling all 4 things was just an interaction I had with a patient. And I think the lesson learned is probably just you're never going to please everybody. This person came to me with a post-surgical condition, post-surgical situation where I had never even heard of the surgery before. So I had to do some research on the surgery myself. And then she had specific instructions on a specific protocol from a specific surgeon that she needed to follow. Fine, great. So got off the phone and whatnot, and I went to the surgeon, and said, hey, do you have a protocol for this surgery that you do? Didn't mention the patient, whatever. Do you have a protocol for that? And they said they're going to get back to me, whatever. They sent it to me, blah, blah, blah. And then the person found out that I contacted the physician to try to, get ahead of the situation and be prepared. And she got offended that I went and got that information from said, I didn't give you permission to do that, which you don't need permission to call a doctor's office, but I didn't give you permission to do that, blah, blah, blah. So she got offended with that. And I hate offending people to my core. I'm a people pleaser. I hate when people don't like me. So I lost some sleep for that, and I still remember that to this day. And that was 5 years ago that happened, and I still think about that. But it's definitely a lesson of you're definitely not going to please everybody. You're not going to be able to sell yourself to everybody. And just like I think it was said before, you're going to refer out to other people if your situation doesn't fit their needs. So I think that was one of my setbacks, I think. But in addition to what was said over here too. Feedback.
I think my biggest setback, which is always ongoing, is how much time everything takes. And I think I had this vision that eventually this practice would kind of be, running itself, and I would have more time outside of the business. But I've quickly learned that I live and eat and sleep. Like, I'm always thinking about running a business and looking things up and scrolling Instagram. And I feel like, but it is also what interests me, right? So it's just challenging time, balancing my time every day, and giving way more time than I think I expected, but I don't mind giving the time. And kind of like Jimmy said, in an ever-changing world, I feel like I have things figured out, and then something changes, and I have things figured out, and then I don't know, there's a PT down the block now, it's just, I think about my business all the time, in a good way and a bad way, but I don't think I anticipated that. I'm working way over a full-time job, but I'm pulling in my own income, which is I'm not blowing out the banks with my income I'm bringing in, because, most of it's behind the scenes.
Yeah. Like look to sum up those answers, right? Like that's what I do just because I interview. So I look for the emotion in that. Bryan talked about, what do you do when the leads dry up? So Bryan started to understand, I'm in the show business. I'm in the marketing business, but he's a PT. It's a PT clinic. Yep. No people to take care of. No PT. Derek said, when I offended someone, Derek highlights, I'm in the relationship business. If that person got offended by that, and believe me, I'm a woo personality too, Derek. That just, hearing your story made me feel gross, right? But that person wasn't the best person for you, because from your point of view, you were going above and beyond. From their point of view, you did something without their permission. Who's wrong? Nobody. Nobody's wrong. You're both right? But that wasn't a good relationship to build. That's okay. We have to remember that. People pleasers like us have to remember that. That's okay. And then Brenda said your biggest setback or pain point is how much time, organization. You realized you're in the time business. You're in the business. So someone much smarter than me said a PT clinic is in the recruiting business, the real estate business, the marketing business, and the business. And PT. That's in there, right? That is how you deliver what you deliver, right? That's the delivery mechanism. PT is how you give that. What you deliver, what you have to do is organization, relationships, and attention. And I think the people who figure that out faster succeed faster. And it looks by accident, it looks like luck, but it's not. It's not luck.
Do you guys ever feel limited in the population you treat or in the amount of money you make, just because somebody might not be able to afford or they might not fit what you are willing to treat?
I was rude and was talking. Can you say the
Do you ever feel limited in the population you treat because you only really stick with like a certain niche, or do you feel limited in the amount of money you're able to make because somebody might not be able to afford what you want them to
Yeah, that's a good question. So in terms of niche, I started out kind of like general population, just being trained in orthopedics, felt like I could help anyone and everyone. But over the course of the last 2 years, realized that it's, if you're, I don't know, Jimmy might agree or disagree with this, but if you're speaking to everyone, then what's the saying? You're speaking to no one, sort of thing. So I started niching down over the last year, working with more runners and endurance athletes, triathletes. And that's worked really well, I think, because once you do a good job with a few people in a certain circle, like people talk and it's more, kind of just it's easier to get people kind of interested in what you do and that sort of thing. So I never really felt limited. If anything, when I was trying to work with everyone and speak to everyone, I was almost more limited. Not so much now. And then your second question about access. Yeah, I think there's a little bit of a trade-off with, if you're going to go in network and accept insurance versus out of network. Being out of network eliminates kind of the friction. It's just cleaner to deliver services and then get paid for those services. But if the trade-off is that you limit access. So the way I looked at it is, in order to kind of financially do what I wanted to do and kind of do what I'm doing now, I would need to see, however many more patients being in network, just based on how I'm reimbursed. So to me, that other situation looked like just doing the kind of being back in a busy outpatient practice. So yeah, I guess there's always that trade-off of access, but that's kind of the cash-based thing we're building better for me.
I think you're getting to the heart of what we have to discuss with patients with cash-based physical therapy in the first place. Like, oh, I can't afford this, type of deal. And what do we have to say to that? And it's how much would it cost to stay in the situation that you're currently in? That's kind of what we're trying to tell patients as well. So, limiting access, I could almost argue that we have access and we aren't limited. We're actually more free to see more people because we're not limited by insurances or this or that, whatever. So we can see whoever we want. As far as affordability, that's about what they value. It's about what they can do. If it's a real problem, how much is that going to cost to fix the problem? How much is it going to cost to stay in the problem that you have? That's kind of the way that you sell that kind of stuff as well. Yeah, I mean, that's in an indirect way, you're getting to the heart of what we have to, explain to people is, oh, I already paid for insurance. Why am I doing it? It's like, yeah, there's some people you're not going to be able to get off that train, but if you sell it the right way, we're adding a value, we're adding access, we're adding more access to me than outpatient clinics will, because I have this right here that since I've been here today, I have texted a patient already. Sorry if that's rude, but I've texted patients here. They text me back. That's more access as well. So it's all about value. It's all about what they're looking for when it comes to the care that they're coming to us for.
I'd like to unpack kind of what their previous experience was with PT too, just to kind of show how maybe how I'm going to help them with their problem would be different. So kind of serves as a little bit of a differentiator. And unfortunately, most patients, when you ask that question, will say, oh, I was one of like 2 or 3 other patients there at any given time. My PT was like kind of juggling and running around, and that's not to put down kind of like the network system, because we need those systems to help people that can't afford other types of services. And also there's the benefit of, as a clinician, being on that side, you do get a ton of repetitions, like Derek was saying, you see patterns and you learn a ton. So there's definitely value in being part of a practice like that coming out of school, a lot of value. But yeah, kind of just it's one way that I like to kind of differentiate my service too, is like, okay, well, what was it like, and did it help, and what things helped, what didn't help, that sort of thing.
Brenda, I think you're muted. It's all right. We've all been there.
Oh, got it. Okay.
There you go.
I feel like in terms of, I don't feel limited by what people can afford, because kind of like we've been saying the whole time, you are selling the value of it, and people buy things, in my world, people go out and buy like get your body back after baby programs all the time online. And so the money, it's just kind of like getting them to realize where they are putting their money. And again, we've said it again and again, but selling the solution. So in a lot of times going out of network, I have found that because of the time spent and because of the partnership between sessions and things, and again, that value, that word we keep using, it actually turns out to be sometimes less money than what you've paid into your insurance and copays and seeing a PT 3 times a week, and getting maybe 10 minutes of time, which is not their fault. I worked in wonderful insurance-based clinics, but you're moving, you're seeing a lot of people. Or you pay out of pocket and you get your hour and a half, whatever it is, kind of get to the root of the problems and have a plan of action between sessions. So I feel like people in my practice kind of see those two sides of the scale pretty quickly. And also in terms of affordability, I mentioned it before, but I do personally, you get creative with it. I do sell group workshops and things like that, and birth prep workshops that are more, if people can't come to see me privately, then they come to a workshop, right? To still get my help out there and the information out there. And then in terms of the niching down, what I learned is that that's actually very beneficial, because as we're all, it sounds like we were all kind of orthopedic based PTs, sports PTs. And so you know the whole body, you can treat anything. However, if you go out and say like, I can treat anything, it's hard to find your people that you can help. But then when I niched down, I realized very quickly how much that actually gave me a more variety of clients, which is weird to say, but like I call myself, and you'll see on my website, I mean, I am a pregnancy, perinatal, postpartum PT, but I treat men, and I treat the person coming after this is 85, and so niching down actually helped people to find me, and realize who I am, because I'm really just selling me, and my relationship with them. So that actually helped me to grow into a bigger variety of client population.
I like when someone else says my answers to things. I like that, Brenda, which is like you sell relationships. So do you feel limited by population or what they can afford? Is this person someone you want to work with, right? That's a who question, not a how question, as in how much does it cost or how will they pay for it? Is this someone you want to work for? If you worked for a clinic, which means someone else is your boss, and you want to give this person a different solution, a scaled down solution, right, that costs less but still has value, you have to ask your boss, and they have to agree to it. And that boss decides. If you are your own boss, you decide. You can make that decision, right? So you're deciding that this is someone I would like to work with. This fills my cup, right? This is why I started this practice. You can give them a different solution. If you serve enough people, you can decide to charge someone nothing. You can decide part of my business will be pro bono. I will seek those people out that I think deserve my help or need my help, and I will charge them nothing because they can't afford it, but I want to give it to them. You have that freedom as a business owner, as long as you understand your numbers and you can figure out what services are you actually providing, what business are you actually in, because if you sell widgets, a widget costs X, and it's going to cost X to everybody. It doesn't have to. Can you sell a different solution? I forget who it was, but one of the guys commented before, like understanding that different things cost different things. If I can get you better in one visit for $300, is that actually better and more beneficial to you than someone who's charging you a copay for 6 weeks? That maths. So you decide. But that is communication. Help me I liked how he said it too, which is help me understand what this cost for you to stay in this problem would be. I couldn't work. I'd be okay. I am now in the getting you back to work business. Let me see how I can do that. But if you own your own business, you decide. You decide. And I'll give the analogy. I think I gave it last time. It's hips and shoulders. If you want a really, really stable career with a little bit of mobility, you want a hip. Super stable joint, some mobility, super stable though. but you don't get to decide. That's safe and stable. Or if you want to own your own business and be able to make these decisions, that's a shoulder. Lots of flexibility, lots of range of motion. Some stability, but it's on you. So decide what business you're in, because if you're on your own business, you can make these decisions and you can do these things.
All right. Next question.
Do you think that it's helpful to have a business degree if you're going to do like cash-based or own your own practice?
That's a great question. Would I recommend it's for everyone? No, definitely not. But I definitely got value out of it. And what I mean by that is I just was exposed to different conversations, different models of thinking, different ways to think about it, as Jimmy was talking about before, just like how the world works and why society and culture the way it is, just like kind of opens your mind, just like any education and any degree is going to do. But I'll also say, just for the more tactical stuff of like, how to create a profit and loss like statement and document, and how do I track that? How do I track my income and expenses? Those types of things, which it really are pretty simple once you start doing it a couple months, but just going in with that knowledge was helpful for me. I wouldn't recommend. Do you need to go back to business school to start practice? Absolutely not. If you're considering it or intrigued by it or interested, maybe it's a good choice. So,
yeah. With a person without a business degree, I would say it depends on how you define beneficial. If it's beneficial for you, may not be beneficial for someone else. You get out what you put in. So if you go to business school and you are passionate about it, you like it, you absorb everything, then you probably got something out of it. But if you go into it and it's not even what you want to be doing, and it's redundant, or it's easily accessible somewhere else without having to pay all the money, whatever, then maybe not. So it's all individual, I think. So it largely depends on how you define beneficial, financially, emotionally, time-wise, time management, all that stuff. So,
do you think that you were able to like figure out everything you needed to like own your own business, like without having like classes on it? I mean, I know you were able to. Like, how were you able to do that?
Yeah. I mean, I think information is very accessible these days. It's a matter of how to interpret all that information and apply it to your own life and your own situation. It's one of the struggles in life in America, in this world, is there's so much information out there. How do you know what's true? How do you know what's beneficial? And I think I've learned that over the 15 years and 5 years of doing my own thing, life and physical therapy, it's all a little bit about trial and error. It's try this out, see what works, and if it works, go more towards that path, and then foster that. Grass isn't always greener where somewhere else it's grass. It's greener where you water it appropriately. So.
Mm-hmm. Yeah, so there were points in starting this that I wish I had more knowledge about running a business, but I do not have a business degree. I realized that going through PT school, that's one thing that I learned really nothing about. But I digested so much information in the beginning. There's a lot of access to PTs who have done this before. I even bought paperwork for a cash-based PT from another PT. So it takes a lot of searching and sifting for sure. Like Derek said, there's just so much out there and you have to figure out what works best for you. And it takes a lot of conversation. I called a lot of people. I think I mentioned earlier, like I called my local APTA chapter and I said, I want to start this business. What do I do? And then she referred me to the business bureau. I said, I want to start this business. What do I do? And then I had to get zoned for my house because my clinic is here and all that kind of stuff. It took a lot of calls, lots of conversations, lots of confusion. And then eventually I figured it all out.
Yeah, I would say, do you need a degree? No. But if you want a degree and that's the thing that you're looking for, then go get it. Like, I don't want to brag, but I have 1/3 of an MBA. 1/3. I went through it. I said I wanted to do this. When I was looking to leave radio, I didn't go right into PT. I did what like most middle-aged dudes did when I panicked. I went to go to law school, hated it. I went to go to business school, lasted a year, didn't love it. And that's when I was riding bikes with somebody and they were a PT and I just liked how they talked to people. And I was like, I want to do that. That's how I figured it out. So do I think you need it? No. But this is also a good lesson, right? Like hire for your weaknesses. You don't have to hire someone full time. Like, I don't know anything about books and a P&L. Great, hire someone. And while they're doing your books, what can you learn from them? There's YouTube University, right? But some people are like, I don't have the time for that. Great, pay someone for their time. Like, I got to give a little knock on PTs a little bit, right? Because I am one, so I get to throw stones in this house, right? We're one of those professions who's like, we could get you where you want to go faster. Why don't you come and see us instead of suffering for so long? Or why'd you go to that professional? We're the best at that. And then we'll try to build our own website, set up our own accounting, do our P&L, figure out how to hire, figure out how to rent space, and never hire another professional. It doesn't work both ways. You don't get to say one, why didn't you hire us to help you get from where you are to where you want to go faster, and then not do the same thing, right? So do you need a business degree? No. Do you want a business degree and you think it would get you more information faster and you are willing, the juice is worth the squeeze, right? What I'm going to put in, time, effort, money, sweat, blood, tears, and what will I get out of that? So my answer is the very, very physical therapy answer. It depends.
I will say that we talk about resources that are out there. I learned as much as I could from anybody I could, including patients. I had patients that own businesses. I had patients that were financial advisors. I would get as much information out of them as I possibly could. The doctors who I worked with ran great businesses. I would sit down and talk to them about business more than I would talk to them about the healthcare stuff. So, any place you can absorb information from is a great way to do it. Again, one reason why we have this course here is so that you can learn from some of these people. And I told you before, so you can learn from all my mistakes that I made.
Yeah. PTs too, like you're talking about like financial advisors as patients, like people on the most part will at least begin to give you their time, right? Especially other PTs. Like we have the Peace Corps gene, and I can say it because I am one. But a lot of PT owners will just say, I'll sit down with you. Let's just get you started. Great. Take them up on that. Other people are hearing bells, right? That's not just me.
Yeah.
Yeah, that's us. It's the bus here at the bells here at Nazareth. I can mute them, but
It's just
hey, Russ.
Hey guys, can you hear me okay?
Yeah.
Russ, live from his car.
Live from my car. I was gonna do it outside, but they got this big train out here. There's a whole lot of noise, and I know you're recording this, Jimmy. So I want to make sure it felt okay here.
Yeah, we're live, just FYI, no editing. So we're live.
Okay, got it.
Perfect timing, Russ. You want to introduce yourself and kind of give a little background on what you do, and then I actually have a question from somebody that didn't make it to class today that we'll go into after that.
Sure. Yeah. Sorry for being a little late here. I had a meeting that I couldn't pass up. I'm Russ Manalastas. I own Man Performance Therapy. We've been in the private pay sector now for, July was 7 years. So kind of crazy. My office is located in Next Level Strength Conditioning in Fairport. We're attached to 2 ice hockey rinks. So kind of our niches are hockey, do a lot of rotational athlete type work. So hockey, golf, see a lot of ACL reconstructions. And then we've been doing a lot more with baseball lately. So our partners in terms of organizations, we have our satellite location at Cobblestone Creek Country Club in Victor, which is about maybe 10 miles down the road from our current office. We have a partnership with Bishop Kearney Hockey Selects, which is a boarding hockey school here in Rochester and Irondequoit. Let's see, we have Smash Sports, which is a baseball company out in Scottsville or Henrietta area. A good buddy of mine oversees that company, so we're doing some baseball stuff there. And last but not least, we oversee the sports medicine and rehab for the Rochester Junior Americans, which is our junior hockey program at Next Level. So we oversee all the injuries, the recoveries, return to sports, and the protocols to make sure guys are, one, not losing time on the ice, but also, two, are getting back in a safe manner. So I've got 3 kids. My life is crazy right now. I've got a dog and a great wife. We just celebrated 14 years yesterday. So listen, I think my experience as a PT, I've seen a lot of places, done a lot of different things, and just trying to figure out how we can keep up with you young studs that are coming out of school here.
Awesome.
I think that's pretty much it. That's my Clip Notes version there.
Thanks, Russ. Something interesting he said there is it talks about his good buddy who he had at Smash It Sports, right? We've been talking about relationships, communication. I actually know his good buddy. We all used to play baseball together.
Yes, we did.
We'd go out there and just try not to get hurt. But
correct. That is correct.
I do have a question that came in here, and it's: do you all work alone, or do you have any partners, coworkers, employees? And what are the pros and cons of working alone versus having others to rely on?
Good question.
And yeah, Russ, do you want to take that one? Because I know you've got some folks.
Yeah, so we're fortunate to have Jason Turry. He's our full staff PT. He's been with us just under a year at this point in time. Jason actually came from the University of Rochester. He was their head of fitness science and performance, and so he's a great resource for us. He's really kind of elevated our practice in terms of just looking at things a little differently and looking at some of the data and some of the research that we have. He actually runs the PT Inquest podcast. So if anyone listens to that, Jason is your host on that podcast, which is pretty neat. And we also have Zach Gabor. Zach Gabor is a part-time PT with us. He works a couple hours a week for us. He oversees clinical athletes. So I don't know if you guys are familiar with clinical athlete, but Zach is the one who oversees that. So we've got two studs that we're fortunate enough to have on our staff that really kind of helps to elevate our practice and elevate the standards of what we think PT is. And it's really, really integrated into strength conditioning, right? And so, a little pitch. I don't know of people in the room that are taking our elective in the spring, Mike, but we run a strength and conditioning elective at NAS in the spring semester. So that's just a little pitch for our class there. But I think the benefits of working with people, especially people that are much smarter than you, I think it just allows you to look at rehab and look at business a little differently. I think while we started our business as a solo practitioner back in 2017, I think the hard part was trying to figure out, like, I can do all these different things, or I can just make sure I focus on what I'm good at and make sure that I can hire people around me that are much better at the other aspects of the business that maybe I'm not great at. So for instance, my wife, Kat, she's a PT as well. She kind of works in a pro bono COO role in our business. So she oversees all of the kind of back end operations, some of the financial stuff that I do and I'm good at, but I know she's extremely good at. So, and then Jason and Zach, they oversee a lot of our protocols and a lot of our programming. And again, my job right now, while I'm still treating in the office, maybe 15, 20 hours a week, my job now is trying to figure out how can we talk to different organizations and different companies to be able to show them the value of what we're doing and how we're much different than just your traditional rehab down the street. So I think the hard part about working by yourself is that there's a lot of doubt that you have in your head when you're a solo practitioner, especially going against the grain and running your own practice, especially a cash-based or an out-of-network practice. And you have a lot of doubt about how much you should charge. Should you be doing this? Selling, right? And I know, Jimmy, we've talked about this in the past, but selling is something that you do each and every day. And it's something you have to be really, really good at. And if you don't sell yourself and you don't sell the service that you're providing, then the person's like, I'm not exactly sure this is valuable for me. I just go down the street and pay X amount of dollars less to get maybe a substandard of care, but it's something that they value because it's cheaper, right? And so I think the hard part about working by yourself is just making sure you've got a good network of people to, one, kind of lean on if you are frustrated and you need somewhere to kind of vent, but also two, the benefits of working with partners is that you can really, really be good at what you think you're good at and then be able to delegate the other roles and responsibilities of your business based on what the other skill sets of the people around you have as well.
All right. Brenda, you want to go next?
Yeah, I can echo that with Russ because I am a sole practitioner. It's just me. Part of that is based on the confines of my current space. I just don't have capacity to take anybody on, but I'm trying to stay creative and open-minded to that and just see what the next steps are for me in that sense, because I miss people. I miss working and partnering with somebody and learning from them and getting new ideas. that don't just come from my head. So, but the way that I combat that is I have strong collaborations in the community. So I do a lot of work with a nonprofit, with a lot of other professionals, and I have a strong networking source where I refer out and people refer to me. We do kind of collaborative workshops, and so that does help me because I am very people driven. So that is one of the challenges of just being me here at home. The positive about it is that it is me here at home, and I have 3 young kids. And so it's very organic and easy to balance my time between when I have a client here and when I have to run up and throw laundry in between clients, So for me, this works right now. And that's why I designed it this way. And it was my goal when I had babies. But I am kind of always looking for that creative next step to again be amongst people and hire out. Oh, and I didn't even say this, but I have over the years when I got brave enough to and realizing I can't do it all, I've hired out a business coach, and I've hired out a branding manager. And so they work for me, but not in the sense of working under my roof. So that helps me a lot.
And now you're actually working from home with your husband too.
Yes.
Whether that's a positive or a negative, but you are working from home with your husband. So.
Yes. He's in the back, I'm in the front. And it's actually ironic how little we see each other during the day or hear each other. But yes, he is full-time work from home now. One of Dr. Huson's good friends.
Yes.
So I've got a little bit of a different situation because I'm very self-aware of my current situation, and I don't seek out and hire out a lot of other resources that I probably should, and it's just I've made it happen and made it work. But in the same sense, I feel like I do surround myself with people that are still in my business. So in my situation, I'm around hundreds of people every day, and the employees at the gym where I am, they're all on my side. They're basically part of my business too, because they're helping. They know the value of it. They've seen it. I help them. They've had personal interaction. So they're technically extensions and branches of me as well that help to build my business and grow my business too. All the partnerships that you make with all the other organizations, like Russ was saying, you partner with this baseball organization, this softball, this soccer, this whatever, if you're going to be in that realm. All that I think is little branches of you, as long as you sell yourself well, like Russ said too. So I think that's a lot of what I've done is not necessarily financially hired. I see the value in it, and I've said this last year too, is that I see the value in it, and I probably should do it. But I've made it work so far to where I haven't physically or actually financially hired people out to do that. I feel like it's a reputation thing, and it's a thing where it's word of mouth with business, with people you have interactions with, and they help to grow it as well. They're part of your business.
Being still kind of early on into this, it's been really helpful, I think, for me to kind of do everything, or at least have a pretty good understanding of how things work. How does website development work? What does marketing look like? If I want to create a newsletter, like what does that process look like? I have hired out some of that stuff now at this point, but I think it can't be kind of understated that it is pretty important to understand like how all the parts work together in your business before outsourcing some of those things. So unless you're completely you have no kind of basic knowledge on how something works, then obviously you need to look to someone for help. But I think at least trying to do some of the things or most of the things yourself early on can be really helpful. So just speaking to kind of who I work with. So I work in a really kind of warm, collaborative space. We do like open houses. We share some clients and patients as needed in that multifunctional health space that I work out of. So that's a really good experience. But I think also just kind of having an idea of what you don't need to have this starting out if you're going to start a practice. But what do you want your kind of practice to look like? As Brenda used the term design, which I really like. Like you can design it any way you want. Like maybe you only want to treat 5 patients a week. Well, that's cool, but like know your numbers and how is this going to work? Like, where's the cash coming from, right? So you need to understand that side of thing. Or maybe you want to just do everything yourself, and you want to be on social media, you want to do all your marketing, and then you want to see all the patients and just not hire anything out. Well, great, that's going to save you a lot of money, but you need to also invest the time into acquiring that knowledge into how to do all those things on top of treating patients. So there's different systems, different business designs, but the cool thing about being an entrepreneur is you're in control of that. So you're kind of in control of that vision. So yeah.
It's the worst because you have to do that thing in PT school that I avoided like the plague, which is a reflection. The worst. You have to like write stuff and reflect and think. Who's got time to think? I'm in PT school. I don't have time to think or learn. I just have to do things. But ironically, by doing that after PT school is when I got and learned the most, when I paused and just sort of reflected. I didn't do it necessarily formally, but I caught myself doing it informally. Where do I want to go? Where do I want to design? What's this going to look like in 6 months or 6 years? Or what could it look like? What you're deciding right now, you're going to bear. That's what you're going to bear the fruit of 6 months or 5 years from now. So be intentional about that. At the same time, being fluid, right? Bruce Lee, be like water. But what do they say? Don't never change the goal, just change the path. Hey, if there's something that's not working, great. Let's change that path, but not the goal. Good. I mean, you got into it for a reason. Don't change the goal. And that goal can be people. And not all of them have to be full-time hires, right? You don't need to make that sort of investment. You do need to make a different investment. Is it an informal relationship, right? I've got mentors that I call that I do not pay them, right? They're just people in my life that want to have that. There are people that I pay to do things like accounting. Not gonna. That's too expensive for me to mess up. I don't want to spend the time doing it. I hate it. And to me, it's too scary. There's too much possible downside if I put a wrong zero somewhere. Someone else digs that. Like, that's why they went to school and that's why they get up. I can't fathom it. I don't understand it, but they like spreadsheets and numbers. Great, spreadsheet all day. So one of the best things I did, I had some people working on the podcast and other things with me. We took one of those like personality strengths finders. We did strengths finders. And the results that I got, like Derek, like you would have gotten woo. That's like one of the personality type, winning others over. Like I need you to like me. If you don't like me, I can't understand why. I can't go to sleep at night, right? A lot of my strengths were not shocks to me. But when we started sharing them together, I realized that I was keeping organizational tasks, spreadsheet stuff from somebody else on my team. And that was the thing she loved. So you see where my personality and their personality were opposed. I wasn't giving her boring tasks because I wanted her to like me. And by giving her spreadsheet stuff, she might not like me. That was the reason she was there. Once I understood that, level unlocked. She got more stuff that she wanted to do, and I got the spreadsheet stuff done and didn't have to do it. So it starts, unfortunately, with that thing we want to avoid in PT school, which is self-reflection. But it works. Who knew?
Next question.
With burnout rates being so high in physical therapists, how do you sort of avoid that with owning your own business and like balance it, making sure you're not spreading yourself too thin?
So avoiding burnout and not spreading yourself too thin while owning your own business.
I feel like it's actually fairly easy to avoid burnout because you're in charge of whatever you want your business to be. If burnout is you're just seeing too many patients, if burnout is you're being told what to do too much, that's all in your control. So it depends on what the burnout is due to, and sometimes you got to find your path, trial and error, find your passion. I enjoy this, so like I'm scrolling on Instagram, I'm not scrolling through cat videos. It's physical therapy stuff that ends up coming up all the time, and it's just because that's what I end up putting my eyes on. So I enjoy it. It's fun. It's a passion. So I think that you just build off of that, and it pretty much avoids burnout on its own. But yeah, if you are burned out dealing with too many people, again, change the path, like Jimmy said. change something. It doesn't have to be everything. It has to be just a little bit of something here and there, and that's probably going to have to be continue to change throughout your entire life. It can't be the same thing the whole time. It's just, I don't think we're wired that way. So, if you change nothing, nothing changes.
Ooh, I like that.
George Brothers, it's not me. Sorry.
Jimmy, you want to go? I think you've done a lot of research, had a lot of conversations on this topic.
Yep, done a lot of research, which is talking about it because it is a frequently asked question. I mean, my dad was a New York City fireman. He walked by a little while ago. Like, number one, where's the fire? Smells like, feels like burnout. Where's it coming from? That's the first thing a fireman needs to do. So what is the thing that is causing you, self-reflection, burnout? And then how do we go around that? How can I remove that from your everyday? Man, if it was accounting for me and I stopped doing what I did because accounting, how frustrated would my buddy be who's an accountant? He's like, dude, I could have done your books in 10 minutes for free. Or you could have hired that guy for $100. I removed that and things got better. Addition by subtraction. So number one is, where's the fire? And then once you figure out where the fire is, the path gets real clear. But burnout is an ambiguous term. Whoever the student was that asked that, she might get burned out doing X. Why is the person next to her not burned out? That part they like it, you don't. Can you change the path without changing the destination? Yes. So find where the fire is. Can I remove it, go over, around, through, under, right? And then can I continue on this path with this deviation? I think the answer is yes. I think the people, what was his name? Darwin? It's not the strongest who survive. It is the most adaptable to change. So if you want to be around for a while, right? You want to avoid burnout, be adaptable, but you have to self-reflect and you have to know where you're going, where I am right now and where I'm going. Man, that sounds a lot like a PT eval.
Brenda, Russ?
Yeah, I mean, I think for me, starting off doing everything from social media, website, marketing, client care, home programs, remote programming, virtual consults, it's a lot. And I think for me, I'm very driven by trying to continue to kind of push our profession forward, but also to try and prove the doubters wrong. Right? Like, oh, you can't start a cash practice in Rochester. There's no way. You're not going to be successful. No one's going to pay this money, blah, 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 blah. So I have a tendency to wear my emotion on my sleeve. And a lot of times when, if you're frustrated or maybe annoyed by situations, you don't want that to spill that into your personal life either, right? I think a lot of time, you talk about balance between personal and professional. I think, unfortunately, as an entrepreneur, as someone who owns a business, it's very, very hard to separate the two. And when you don't separate the two or can't do that, it can be very, very challenging to live the life that you, quote unquote, want to live, right? And so, while yes, we have the autonomy to do what we want to do and change the path and all that stuff, at the end of the day, like, the reason why I think a lot of us get into owning a business is because we're passionate about what we want to do and how we want to do it. But when we have barriers in our way, or if we have things that are not going the way we want, can we be able to adapt and not get frustrated and not need to have more leads come in, be present and be okay with the moments that we have. Because we all want more, right? We all want to see more people. We all want to make more money. We all want people to recognize what we do and how we do it. But sometimes still looking back and reflecting and saying, hey, this is pretty cool what I'm doing. Being okay with that too is really, really important. And so I think, there have been moments where I felt maybe quote unquote burnout-ish. But sometimes you just need to have a little bit more self-reflection to understand, hey, look where you are now compared to when you first started. Things have gotten better, right? Maybe not at the time that you wanted to, or maybe not, in an expedited manner, but things were better than when you first started, and that's important as well. So I think burnout is, yes, definitely controllable. You got to find the source of it. And once you find the source of it, sometimes you need to then be able to delegate something that you don't necessarily want to do to help take it off your plate. If you can take it off your plate, it's going to alleviate a lot of stress that is then self-inflicted. Yeah. And that's the stuff that I think becomes really important, especially if you're starting out in a new business or starting out in a new venture or side hustle, whatever that looks like. Yeah, you want to do all the things. You want to just have it be a home run from the start, But if it's not, how then do you deal with that? And then how can you make sure that you've got, again, the people around you, whether it's business coaches, the right people around you to make it more palatable to be in the position that you're in?
Mm-hmm. Yeah, I don't have anything new to add there because my burnout also comes from not client care, because that's what I love, and also it's always changing, and I design it. But all the extras, and it took me a while. I felt very burnt out by marketing and the social media aspect and those sort of things, because I feel like that is not necessarily my strength. And so once I found that branding manager and outsource it, that has been taken off my plate and it's working. And we joke all the time because she calls me, she's like, you need to do this. I'm like, you give me like goosebumps even thinking about doing that. And she's like, okay, I'll do it for you. Just get me a video. And so I send her a video and she does all the things. And so that learning that has helped me a lot with burnout, because it is a lot owning your own business. So I'm not afraid to do that anymore.
All right. Parting shots. We'll start with the gentleman in class, then go to Brenda, then Russ, and we can wrap it up. So parting shots. What would you want to leave with everybody as we sort of wrap up here? Derek, why don't we start with you?
Okay. 3 quick things. I like Jimmy, I like quotes and whatnot, so I have a couple on my wall in my office. Aristotle, Albert Einstein, have you heard of him? Life requires movement. Of course, everything requires movement, and everything is geared back towards movement. That's one of the reasons I named my business, have that word in it. Life requires movement. And also with Albert Einstein, nothing happens until something moves, okay? That can be adapted to life. So if you need to do anything, if you want to do anything in life, you got to get moving, and you literally, physically, spiritually, emotionally, you have to just keep moving. You have to keep adapting. Nothing changes. All those kind of quotes, I think, are huge. But I say it all the time when it comes to patients, just educating them all the time. By the way, my number one treatment service I give to patients is education. It's not exercise, it's not manual work, it's education. That's the number one thing, by the way. But movement is key. Keep moving, keep going towards your path. That's one of my parting things. The last thing is the quote I say to patients, which I think I came up with, doesn't matter. Influence the other 167. So how many hours are there in a week?
168.
Thank you, 168. So if they're with you for like an hour or less, let's say, right, as a physical therapist, whether it's twice, 3 times a week, whatever, collectively, if they're with you for an hour, you're influencing that, hopefully-ish. But you really need to influence what they're doing at home, because that's a huge amount of time that they're not with you. So make sure that you are influencing their 167 that they're not with you. That's when I think you're going to make a bigger impact in their lives and getting them better. And that's when you're going to get the business when it comes to word of mouth. So influence the other 167.
I don't know if mine will be as powerful as that, but I'd say my parting shot would be, I think we talked a little bit about kind of self-reflection, self-assessment. Do take inventory at some points. It doesn't have to be every day, but every once in a while, take inventory of what are my unique abilities, what are my strengths, what are my values. You each are different in those 3 things, right? You each value different things, you each have different strengths, you each can do something a little bit different than someone else. So if you're thinking about starting a practice, just as an example, because that's why we're here, I love working with golfers. Okay, awesome. I love working with golfers too, but what are your unique abilities, what are your strengths, and what do you value about that? That's going to be different for me, and that's your differentiator. So take inventory of that, and if you can align those things with your path and what you want to do, you're going to be happy. And well, happiness is kind of a limited phrase, or term, but you will decrease that risk of burnout. Kind of going back to that conversation. So I think the weed whacker's cutting me off. Yeah, think about your abilities, think about your strengths, think about your values, and see if you can find something, a passion or a path that aligns those things.
Yep, and mine is, don't be afraid to say yes to different opportunities, not knowing where they're going to put you. If it excites you, and moves you than just being open-minded. And we've all said, like, we're on a path that we couldn't have really thought about or designed in PT school. So don't be afraid to really think about and decide what you want to do with your degree. And nothing is an answer too. If you go and like totally do something else, that's an answer too. But just kind of going through it and saying yes to whatever you feels right for you, because there's so many opportunities within this profession. And obviously I do love this profession, that you can be so creative. You don't have to get stuck in a box or be afraid to get out of that box.
Yeah, I love that. I mean, I think I've got two things. We all get into this profession to help people, right? But how we help people can look a lot of different ways. So I think the first one is be okay with hearing no. I think a lot of times if you're trying to do entrepreneurship, or if you're trying to do something different than your traditional path, be okay hearing no, because you'll probably hear no a lot. I'm sure we hear no a lot in a private pay sector, right? So don't take that personally. Just find a better way to connect with that person so you get them to say yes. So that leads me to my second thing, which is get better at selling yourself. Whether that's in a traditional practice, whether that's in a side hustle, whether it's in a full-blown cash practice, whatever that looks like, get better at the conversation you're having with someone so that they say yes more. I think the more you can sell yourself, the more you're selling whatever service you're providing. And again, it doesn't have to be X, Y, or Z. It doesn't have to be needling. It doesn't have to be manual therapy. It doesn't have to be exercise. You're selling an outcome to them. The outcome is they need to get to this point, and they're currently here. How are you getting them there, right? So sell the outcome, right? Make sure you're good at that. And then again, if you're hearing no more often, then that's a conversation you need to have with yourself in terms of your sales process. What does your process look like? How are you doing that? And what are your rebuttals if people are skeptical about the services that you're providing? I think that's something that I learned pretty hard when we first started going, right? When we're like, hey, we're going to charge this amount of money. If we're hearing a lot of no's, why are we hearing a lot of no's, right? And that's when sometimes, like Brenda, you hire a business coach to get you more confident in your sales process. Because again, when you hear a lot of no's, all of a sudden that doubt starts to creep in your mind and you're like, am I going to be able to do this? Am I going to be able to sustain this? And so I think number one is get used to hearing no, but then number two is get better at sales so that all of a sudden those no's turn to yeses.
Well said. I will keep it short and sweet. Self-assess. Man, that reflection thing, it comes back after PT school and it works. Decide what business you're actually in. Needling, cupping, physical therapy, those are all hows. Those are hows. People don't pay for products or services. They pay for relationships, stories, and magic. They want to be the hero of their story. Luke wasn't there for the lightsaber. He was there to become a Jedi. It was the journey, right? So pay attention to that. You're Yoda in that scenario. And always change the path, not the destination. It would be a real shame. And I forget the number. I was talking to Larry Benz, who runs Confluent Health, pretty big organization in PT yesterday. He was giving us numbers on how many PTs are leaving the profession, or sorry, not just the profession, leaving clinical practice. Said about 19% of licensed physical therapists are actually treating patients. I'm not a math guy, but that's 1 out of 5. Why did the other 4 out of 5 leave? I think a big answer to that would be they changed the destination. This is too frustrating. This how is too frustrating. So I'm not going to go to that place, do that thing that I wanted to do. I'm not going to go to that place anymore. So change the route, but not the destination. That's my parting shot.
All right. Thank you to everybody here. This was awesome. Students, I think they're shaking their heads yes. They loved it. Thanks, guys. And Brenda, always fun to do every year. And Jimmy, thank you for hosting this. These are some of the smartest people I know and some of the coolest stuff, so I'd like to have them share. Thank you all.
The PT Pintcast is a product of PT Pintcast LLC. It is hosted and produced by PT Pintcast CEO Jim McKay and CBO Sky Donovan from Marymount University. We talk PT, drink beer, and record it. This has been another pour from the PT Pintcast. The PT Pintcast is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. More on the show at ptpintcast.com.
The show today brought to you by the Academy of Orthopedic Physical Therapy, the leaders in orthopedic physical therapy. Find them online at orthopt.org. Now, with their current concepts of physical therapy in their 5th edition, it can help you prepare for that OCS examination. Find them online at orthopt.org. The Brooks Institute of Higher Learning gives you advanced post-professional education with 7 on-site PT residencies, including orthopedics, women's health, pediatrics, sports, and neurology, as well as an OMPT fellowship, all focused on experiential learning. Find out more at brooksihl.org.